Hi, today we're talking foam rollers. What is it? How do you do it? Is it effective? We'll answer those and other questions in this video. And later, I'll show you some other techniques that you can use to decrease muscle tension in targeted areas. Hi, I'm David Spear and welcome to Practically Fit, the video series where I help you make sensible and practical decisions about your fitness and health. If you're new here, let me tell you how this works. First, we start out with a description. I'll give you a brief overview of what it is we're talking about, the topic at hand, and maybe sometimes we go into the physiology if we're talking about something that has to do with anatomy or a piece of equipment or even an exercise routine. We move from there into the demonstration. This is kind of the nuts and bolts of the video where I show you the how to do the exercise or how to use the piece of fitness equipment that we're talking about. We move from there into the classroom where we discuss the data and we really get into what supports and what does not support the claims that are being made by the topic we're discussing. And then we finish with the so what. And that's my favorite part because that's really where I give you the practical information that this video is based on. I also give you some general recommendations on how you can start your own program using the piece of fitness equipment or the exercise routine or anything that we're discussing in the video. And if you're new, please click on the subscribe button, like the video, check out the blog, which is in the description below. We've got a lot to do, so let's get started. The foam roller was brought into being by a Ukrainian-Israeli engineer and physicist named Moshe Feldenkrais. Feldenkrais also pioneered the Feldenkrais method, which was a therapeutic intervention that raised awareness, increased proprioception, and benefited overall health. Foam rolling is known as a form of self-myofascial release, whereby body weight is applied onto the device to target specific tissue that is tight or stressed. Foam rolling affects fascia, a thin, multi-layered sheath covering various areas of the body to stabilize and support muscle and internal organs. Fascia is made up mostly of collagen fibers and separated by a gel-like substance that promotes lubrication for ease of movement and functionality. Foam rolling works by something called autogenic inhibition. This is a process by which certain neuromuscular mechanisms turn on and contract to prevent overstretch, while others turn off, deactivating the first set of mechanisms, allowing muscle to relax. And please visit my blog on static stretching if you'd like to learn more about the neuromechanisms involved. Foam rolling can be performed in many ways, but to get the most out of it, it should be done slowly and deliberately. Here are some common foam rolling exercises. Okay, as mentioned, using a foam roller needs to be done slowly and deliberately. First, we're actually going to start with our hamstrings, the back of the leg. And this is a really nice exercise to do for allowing for more efficiency of movement in the legs. Also, it can help to reduce tension in the low back. So we're going to start with a one-legged hamstring foam roll. I'm going to move back so you guys can see here. And so I have the foam roll placed just below my hamstring here, and I have this leg placed on the floor. And I'm going to lift my body up just a little bit so that I can get into the belly of the muscle. You can kind of see it rolling right in the back of my leg there. And I'm moving real slow here. Now I find a trigger point or I find a point of tension, and I'm going to hold that point and just kind of slowly move along that point of tension. Again, about 1 inch per second. Now I can also do this with two legs here. If I have good balance, I can kind of balance myself on my hands as I roll. And this is also very effective. And you can get kind of 2 for 1. Now, I'm also going to roll my calves. I'm going to show you how we do that. And the calves are usually pretty sore. So I'm going to Keep that roller in the belly of the calf. And the nice thing here is I can move my feet into various positions. This is known as plantar flexion. This is known as dorsiflexion as you pull the toes toward you. And as you do that, you change sort of the shape of the muscle on the foam roller, allowing it to target various areas. The third one I'm going to show you is actually going to be a back exercise. So I'm going to lie down with the foam roller horizontal below the middle of my back. My feet, I'm going to move back so you can see here. My feet are flat on the floor. I'm not really in my low back. I'm kind of in my mid back. I either want to keep my hands across my chest or at my side, but what I'm going to do is I'm going to lift my butt up so that I can get a little bit more pressure in the middle back there. And then again, find the point of tension and just sit on it and apply pressure, rolling about an inch per second. If you have your hands up here, you apply a little bit more pressure, but it does take a little bit of balance to stay on the roller. Remember, try not to go too low into the low back and try not to go too high into the neck. Stay right on the middle back there. So these are 3 activities that you can do with the foam roller, and there are many, many more. Please check out the blog, and you'll see all of the exercises that I've listed, which will give you a really great routine to get started. Welcome to class. Today we're going to discuss the effect of foam rolling in 4 different areas: performance, recovery, flexibility, and pain. For performance, foam rolling is neither good nor bad. It doesn't either improve or hamper performance. Studies done on Division I NCAA linemen found that their strength and their velocity or their speed was not hampered after doing foam rolling. Su et al. Also found that there was no negative effect on strength. However, it is effective when used in conjunction with a dynamic warm-up, but it is not to be considered as a performance tool by itself. When it comes to recovery, the data shows that foam rolling is quite effective. In a study done on 18 professional soccer players, foam rolling resulted in less of a perceived muscle soreness after exercise. And in 33 adults who did exhaustive exercise, their perceived pain was less after foam rolling, and that lasted 2 days after they had finished their activity. The final say is that foam rolling is a valuable tool to speed recovery and also to reduce perceived pain. When it comes to flexibility, foam rolling is quite effective. Data show that foam rolling can enhance range of motion in various joints like the hip, the knee, and the ankle. And they hypothesize that this may be due to an increase in blood flow to those targeted areas. However, the results are transient. Some of the data actually show that the increase in flexibility disappeared around 10 minutes. So the final say is that there are transient increases in flexibility. Those may be influenced by the amount of applied pressure to the targeted area, but also, as we talked about before, if you do the foam rolling with a dynamic stretching routine, you may be able to make those increases in flexibility last a lot longer. Foam rolling has also been shown to increase pain threshold, although those benefits are somewhat transient. There are studies that have shown that that increase in pain threshold actually disappears after 2 minutes. Specifically, Vaughn said that there was a significant increase in pain threshold, but that dissipated after 5 minutes. So the final say is that in terms of pain threshold and what you're able to tolerate at that particular targeted area where you're applying pressure, that will increase as you foam roll. However, it's going to disappear pretty quickly. So my advice would be, if you are going to foam roll, you do it regularly so that your body starts to adapt to the type of pain that you're experiencing and the kind of pressure that you're applying to the targeted area. The negative side effects of foam rolling are quite minimal. So one thing I would recommend is that you don't foam roll during your workout session. Power has been shown to decrease during a workout session while foam rolling.
So you're not going to do 5 exercises and then go and foam roll and then do another 5 exercises. Either do it before your workout to increase that flexibility and blood flow, or after your workout to help with enhanced recovery. It can also lead to bruising and pain, the bruising from the applied pressure, and the pain is part of the process. So as you acclimate and as you adapt to your foam rolling, you'll start to experience less pain in those targeted areas. And it can lead to soreness as well, and that is part of the process, where you may be sore after the first few times that you foam roll, but again, as you adapt, the soreness will become less and less.
Okay, just a moment to list some of the contraindications of foam rolling in individuals who should not be using a foam roller. Individuals with neurological dysfunction, those who have had a stroke or any kind of transient ischemic attack, something dysfunction in their brain, should probably not use a foam roller. Individuals with heart disease, specifically high blood pressure, hypertension, should not be using a foam roller, as the applied pressure may cause increases in pressure in targeted areas. Individuals with bleeding disorders, where applied pressure can cause rupture, should not be using this. Individuals who have osteopenia, which is loss of bone, or osteoporosis, should not be using a foam roller, as that can cause fractures, and people who have gone through recent surgery as well. And one other thing I'll mention is that for people who are older, who may want to use a foam roller, which it's been shown to be fairly safe and effective, I would recommend using a partner, somebody who can help you get down on the floor into the proper position, and also keep the foam roller in a convenient and accessible location so that it's easy to use when you're ready. Okay, so you kind of saw how foam rolling works. Let's talk a little bit about the equipment itself. So there are various types of foam rollers. This one is probably one you've seen. It's most common. It's a light density foam roller. It's basically just made of pressed foam in a cylindrical shape. They make these smaller. They make them as in shapes of wedges, and so you can get them in all different ways. Now we have two different kinds of foam rollers. I'm going to come up a little closer. These are ribbed foam rollers. A little bit softer here, but they have ribs so that they allow for targeting two specific areas. And this one's really nice because it's very small, and it really can get in there. And if you see that this is really hard plastic on the inside. Some foam rollers are actually made of PVC piping. If you can roll on PVC piping, then you can tolerate a lot. They're very hard and stiff. So with these, though, the smaller they are, the more they can get into that targeted area. And speaking of which, foam rolling can also be done with a ball. Now this is kind of a softer tennis ball, but you can use a tennis ball that's highly pressurized, or even some people use golf balls or lacrosse balls. Again, the smaller the ball, the more it gets into a specific area when you foam roll. So those are various types of foam rollers, and applying those foam rollers to the various kinds of activities that I showed you and the ones that are in the blog, and you have a huge variety of foam rolling exercises that you can do. Okay, as we come to a close, here are my general recommendations. First, consult with a physician or an exercise professional that you trust before you start with your foam rolling routine. Do your foam rolling slow, 30 to 60 seconds each set for 3 to 5 sets on each targeted area. Take 10 to 30 seconds between sets. Move about 1 inch per second, so don't roll over the foam roller like you're kind of rolling into various areas of your fitness facility. Take it slow. That's really important because it lets you put applied pressure on that targeted area much more efficiently. Roll to discomfort and be in a stretch position. So if you're rolling your lats, you want to be in a stretch position as you roll over the foam roller. Roll every 48 hours max. You don't have to do it every day. You should probably take 2 days between the times that you foam roll. Don't roll your low back because it can spasm, and don't roll your neck. If you are looking to de-stress those areas or work on those areas with myofascial release, you should probably see a professional who does that. Try a variety of densities, lighter densities, heavier densities, even balls can be really beneficial, especially for small areas like on the bottom of your foot or even in your butt. And don't foam roll between sets, as that's been shown to decrease performance, especially when you're doing it during a workout. So what? So here's the deal on foam rolling. As far as performance, it really shouldn't be used as an aid by itself. It should be used in combination with some type of dynamic stretching, as it's been shown that it doesn't really improve performance, but it also doesn't hamper performance. So you're not really getting anything out of it in that regard. As far as recovery, foam rolling is great for muscle soreness. Could really help in increasing blood flow to certain targeted areas, which really helps to speed up recovery. When it comes to flexibility, foam rolling has been shown to be an enhancer. It's been shown to improve flexibility, either that's through blood flow and circulation or just breaking up those adhesions in those targeted areas, those adhesions of the fascia in those targeted areas, allowing for greater movement. And when it comes to pain, pain is part of the process, but the more you foam roll, the more you get acclimated to the pain and the higher the pain threshold becomes. So overall, I think foam rolling is an excellent method to use before exercise if you're going to be using it for increasing flexibility and movement efficiency, or after exercise if you're going to be using it for recovery purposes. That's foam rolling. If you want more of a dive into the science, please check out my blog and visit my website as well. If you're into these t-shirts, you can order one through there. Also, like this video and subscribe to the video series, and check out the description below. In there, I've left links to various types of foam rolling activities. Keep your questions and your comments coming. Let me know what you want me to cover in the future. Thanks so much for watching Practically Fit. I'll see you next time.